I call this meeting of the Northeast Independent School District to order. Let the record show that a quorum of board members is present, that this meeting has been duly called, and that notice of this meeting has been posted in accordance with the Texas Open Meetings Act, Texas Government Code, Chapter 551. We are not going to adjourn into executive session. We do not have anything that needs to be done, so we are going to item four matters. We're skipping all of that. Sorry. We're going to item 5, new business for possible board action. You all right?
Yes, swallowed wrong, sorry.
Because you're up. A, school opening student phase-in plan. Presenter, Dr. Micah.
Thank you, Madam President. One thing that I've learned over the past 4 months.
Oh, wait, I'm sorry. Time is 5:32. Sorry.
No problem.
Well, somebody would have yelled that at me, so.
Is that COVID-19 is unpredictable, and we all must be prepared to pivot as information changes. We are all going through a very stressful journey together, but we may be taking different routes to our destination. All over the United States, school leaders, like myself, are choosing ways to open. And I want you to know no one has a roadmap to get us there. We do not have someone who can tell us how we managed the last time, because no one has experienced anything like this before. I would encourage us all to not judge another district's approach during the pandemic, as each district has its own unique circumstances and needs. Our plan that you will see tonight is based on health metrics as well as the voices of our parents and our staff. We must listen to both the medical experts and the needs of our very diverse community. This pandemic has impacted our families in many ways, and it has really emphasized the vital role that schools play in our communities. I've received an email from a single mother who just moved here for work, but does not have any family or friends in San Antonio or in the state of Texas. She is facing a difficult decision right now of quitting her job if we do not return to in-person instruction. This is a decision that I know many families in our district are grappling with. In a recent working parents survey by Forbes, 73% of the respondents said if schools and daycares do not fully open and remain open, then they will need to make professional changes such as amending their schedules, looking for a different job, or leaving the workplace altogether. I am acutely aware of the strain that school closures have put on our students, parents, and our staff. We have held Zoom calls with teachers. We have surveyed parents repeatedly over the summer about their preferences on virtual learning or in person, spoke to our principals, our CICs at all of our campuses, and our PTA. We know that many families are anxious for a return to in-person learning, and I want to assure you that I believe schools should open. Tonight, we will be talking about when and how we propose for them to open. As I've stated before, we must be strategic about how we open our schools. I want you to know that opening schools with protocols in place, quite frankly, is the easy part. Keeping them open is the difficult part. If we open schools and then have to close them, maybe multiple times, that will be a difficult situation and put further strain on our community. A micro-closure, as you may have heard, means that a school is open one day and you get a phone call or an email at the end of that workday saying that schools are closed tomorrow and potentially maybe for several days. That will be the reality if we do not contain our community spread. Metro Health has the authority, and I don't think people remember this, to close our individual campuses to control an outbreak. So it takes all of us doing our part to offer the very best environment to prevent the spread. The health of our staff and the health of our children is very important to myself and to my staff. We published our back-to-school safety plan for parents on August the 3rd with specific safety protocols for in-person instruction. Those protocols are only good if people follow them. It will take all of us, and I want to repeat that and emphasize, it will take all of us, our community members, our students, our employees, our parents, to keep our schools open. We must be diligent during the school day and within the walls of our buildings, but please remember it does not end there. If staff, parents, and students do not take the proper measures away from school, then they will bring the risk of community spread into our buildings. Since we closed down in March, I have seen social media posts with vacation photos in crowded places or group events where people are simply not wearing masks. Please remember, we are all in this together. If some in our community are not following the recommendations of experts, then we will all be impacted. I can open schools for our community, but keeping our schools open is everyone's job. People have told me over and over that they feel helpless. They're not helpless. We can all help in a variety of ways, and it begins every morning with the screening process. If you or someone in your household is showing symptoms associated with COVID-19, then do not come to work or school. It begins there. I understand truly that parents have to work, and our employees are amazing. They are, and they are so dedicated to what they do every day. But please don't send your child or come in yourself if you have fever or illness. There are no guarantees, and I think we all know this, of when things are going to get better. The Bexar County numbers right now are heading in the right direction. I watch them every day. Thank you, Chief, for that. And I'm so appreciative that they're moving in the right direction. But I want to remind everyone, the Labor Day holiday is coming up. If people start to relax and get together in groups, then I feel certain we will see a spike again in our health metrics in our area. It's simple. If you want schools to reopen to in-person instruction, then be cautious and stay the course. Our plan tonight that you will see looks very different, without definitive cut points or health metrics or definitive dates for opening. I simply won't do that and give you that plan because our schools are so vastly different, as you all know. We have to plan in increments instead of absolutes. The physical capacity of our buildings, enrollment from school to school, and demand for instruction, in-person instruction varies drastically, as you will see tonight, from campus to campus. The size of our schools and the needs of our families will drive when and how we open in-person instruction. Opening a smaller school like ACE, as you all know, the Academy of Creative Education, or Wilshire Elementary, is simply not the same as open Reagan High School. There are different needs and different challenges that present at each one of our buildings. Rather than taking a broad brush approach, the plan that you will see works to balance the health and safety of our staff and students with the need for in-person schooling. We also have to consider the mental health of our staff and students. The adults and students returning to school may be feeling a great sense of loss or grief. That is why I'm so proud, as you saw this Monday, of the Adult Wellness webpage that we've provided resources and helpful articles to our families and our employees. Now more than ever, I urge us all to work together and support one another. We must provide enough flexibility to our principals to adapt to the needs of their community. And we ourselves must be adaptable as our community health situation changes. I think you will see tonight, members of our board, that our plan will allow us to be fluid as we continue to navigate this crisis. I want to remind everyone, we've heard this repeatedly, COVID-19 isn't going to go away anytime soon. So we have to learn to coexist with it. And we must learn to work with what is in our locus of control. And I hope that you will see tonight that is our plan that we have focused on. So with that, I'm going to turn it over to Dr. Newman to kick off our presentation. Thank you.
Thank you, Dr. Micah. Good evening, President Grona, members of the board. As Dr. Micah shared, this is an extremely complex situation. We need to move slowly, carefully monitoring various data points in order for our schools to open and remain open. The plan we developed and are presenting to you this evening allows us the flexibility necessary to best take care of our students, our staff, and our parents, despite frequently conflicting guidance. It was very important to us to hear from all areas of our large district. We sought input from various stakeholders to include our campus improvement committees, and as a reminder, the makeup of CICs are teachers, business partners, and parents and administrators. We asked for principals to reach out to their campus PTA executive board members. I talked to several principals, and Dr. Micah conducted teacher listening sessions throughout the summer to seek input about the best way to phase students in. While all students and parent requests for in-person instruction will eventually be granted, it was evident that our special needs students were a priority based on the feedback we received. Other groups that were identified during these brainstorming sessions were students whose parents need to work and don't have childcare, our first responders, the at-risk students, and our academically struggling students. So there are 4 considerations that we examined when developing this plan. They are building capacity, which Mr. Clary will discuss, the parent survey, which Mr. Jarrett will discuss, the Metro Health Risk Assessment that Mr. Jimenez will discuss, and the 4th one is the needs of our NEISD community as communicated to us through email, conversation, and various social media postings. Again, these needs vary greatly throughout our diverse communities, and at this time I'm going to turn it over to Mr. Clary.
Good evening, Madam President, members of the board. When Metro Health issued guidance on having 10% occupancy in the building, we started scrambling to figure out what that meant. Fortunately, we have a staff in our construction management department, mainly with Josue Briguette, that we were able to figure out that information, what our 10% occupancy would be. When you look at the numbers that are going to be on the next page, you may see some campuses that are similar in square footage, but they have a different occupancy number. Some of the things that go into the formula for figuring that occupancy have to do with how many exits are in that building has, how far the exits are from each other. Also, square footage is taken into account. But that's not the only number we look at when it comes to occupancy. There's also the instructional occupancy, which you see a lot through presentations, and that's simply the number of kids or number of students that we can have in our facilities based on the number of classrooms that we have around the district. So on the next couple of pages, you will see what 10% or what the occupancy of our campuses, the formula that we came up with. And I'm going to turn it over to Mr. Jarrett at this time.
Madam President, Dr. Micah, members of the board. So as Dr. Micah talked about earlier, we've sent out several surveys throughout the summer in an attempt to do a few things. One, we wanted to identify early on what our student needs were in case we had to close schools and go into a virtual space. So our first survey was to really data gathering so we can start to capture the right amount of resources and put them in the district so that we can supply our kiddos a great learning experience. So as we got that data, we ordered hotspots for our children. We gathered Chromebooks and other devices for our kiddos, and it was based on the survey data that we received. we use the data in two different ways. One is that there's absolute numbers, and then we use that percent to kind of do predictive numbers. The predictive numbers mean these are folks that did not fill out a survey because maybe they didn't have an email, maybe they didn't have technology, and we use that to kind of make an assumption. How many more do we need in case these people came forward and needed a device? Once we did that, then we went through our system where we identified by student ID number specific children that need a device. And what's important to that is that as we send a survey out, it talks about a family or a household. This second survey was very specific to an individual child, because to learn virtually in a synchronous environment, every single child has to have a device so they can log on and engage with their teacher on a frequent basis. And so we did that. The other thing that we did is that we made sure that there was a hotspot for a family, and how much capacity did those hotspots have to support each child as they engage in a synchronous learning environment. And so with that, we also recognized that there were some families that had younger children that did not have the opportunity to engage in a synchronous learning environment during the school day because they needed assistance from their parents. So we developed an asynchronous plan for children to engage in video lessons that are pre-recorded by their teacher, and they can learn exactly what they need to do during the school day. So we created agility within our day in a virtual space. But all that being said, we knew that we had to also develop and design a plan around our kids re-entering school. And so in order to do that, we sent out a survey that said, do you want to be in school virtually or in person? And so if you look at this data shows that we have 43.8% of our people saying they want to be in person for instruction, and 54.8% saying they rather maintain virtual at this time. Again, everything is going to be fluid, like Dr. Micah talked about, and so we have to create an agility within our instructional framework that allows kids to enter and leave school as we run this risk of COVID. And so at this time, we have 36,694 respondents. That number is important to us because that actually margin of error is actually, we're with 99% confidence that is how it will look if 100% of our folks responded. And that's statistically significant because there's only a 0.337 margin of error, and that's using a z-score where your margins are different up and down. And so when you look at this, we also went farther and we said, okay, based on this number, we asked how many devices will we need to support kids in a virtual space, and then while we have kids in school. And so this is the numbers showing how our kids will need internet. And you'll notice that 93.9% of our student bodies have high-speed internet at home, but we have 5.9% that didn't. So executive staff and Dr. Micah, we ordered hotspots for those families so those kiddos can log on online. We did the same thing for technology, which includes either a Chromebook or iPad, some type of tablet, because those kiddos can learn virtually as well. What's also important to mention is that we recognize the possibility of micro-closures. These micro-closures could happen at any time. We want to make sure our kids have a continuity of learning, and so if that micro-closure happens, these kiddos will still keep their device, and if we have to close, they will log on the next day and engage in a synchronous environment with their teacher again. And so we really tried to wear our belt and suspenders in designing our plan around this. And what I want you to notice in the next slide is that these are the number of traditional and virtual. And what you'll notice is, and I'll go to the top first, and I can barely see. I think my eyes are aging or something. But when I look up there, so if you look at high school, Lee High School, I believe it says 440. And that is how many children will want to come back to school in person. And what you'll see at Reagan is 1,229. The reason that's important to note is we have to make a plan different for each of those schools because we have to do a soft opening so we can stay open. And so where Legacy may have the ability to support most of their kids getting in the first phase, Reagan may not. And that's important because a lot of times we think, okay, let's just open the doors in its entirety, but we need to be careful and be very targeted in how we approach that. And you'll see the same thing happen in middle school where you'll see 97 at one of the middle schools and I believe it says 418 at another. So you can see how it varies from campus to campus. And we see that same trend happen in our elementary with the lowest, only 71 students want to be in person, and another campus 254. So there may be some campuses that open at a higher rate where they're saying all the parents meet their in-person needs, where another campus may be phasing in because of the interest level of each of those families. And so I bring this to you because these surveys were important to us because we wanted to be not assume anything. We wanted families to have a voice. We wanted to hear from them, and we wanted to make sure we gave and met their needs where they were at. And I think at this time, I'll turn it over to Mr. Jimenez.
Thank you, Mr. Jarrett. Good evening, members of the board and guests. Another district consideration is the Metro Health Risk Assessment. We all understand that our community, and really our world, is dealing with a health crisis. We have to be mindful of the data that is collected and shared. Our schools may mirror what the community is facing. And so it's important that we understand this information and consider it as we build our plans for our schools. And so many of you may be familiar with this, and so this data shows our city and county's risk level represented by a bar up on the top that ranges from safe to critical. 7 different metrics are used to determine the city or county's placement on that. And you can see that by a little black triangle that's there that right now is unsteady. And so there are 4 progress indicators that reflect an effective community response to COVID-19. And the first one on the far left, that orange graph, is a sustained decline in the number of new cases of COVID-19 within a 14-day period. The next one is the ability to perform tests for the virus in all people with symptoms of COVID-19. Next is the effective contact tracing capacity to identify all close contacts of people diagnosed with COVID-19. And then you have a prepared healthcare system that can safely care for all patients. And they look at this through some metrics like sufficient hospital capacity, sufficient PPE. And then there are 3 warning indicators that signal an increased need for public health safety. You have a decrease in the number of days it takes for the number of COVID-19 cases in our community to double. That's the doubling time. So as long as the number is higher than 18 days, we're in the green zone. That's a good thing. It takes longer for the virus to double. And if the doubling time drops lower than 18 days, then that warning is triggered. I believe right now our city is and county's in 24, so we're above that. Another warning indicator is an increase of the percent of COVID-19 tests that are positive. And so a warning is triggered if there is a consistent rise in the weekly percentage of total tests that are positive. And then finally, you have an increase in indicators of health system stress. So that's you're not having enough PPE. Hospital beds are hard to come by. Ventilator capacity, it's low. So those are all reasons that a warning would be triggered. So below on the bottom, you see remote learning for schools. There's a school risk level indicator, and that has 3 levels. And it's low, moderate, and high. And it uses 1 progress indicator, which is this one right here, the 2-week decline, and it has 2 warning indicators, doubling rate and positivity rate. So schools, according to this model, are rated as a high risk, even with a steady risk level designation for the city and the county. And so schools traditionally have more people. There's more bodies in there. And so even with and because of that, it adds to the risk. There's more of a risk factor because you're gathering more people in there. And so even within this indicator, there are recommendations that are given that you're looking for a higher levels of safety protocols for students and staff in the red zone than you would in the moderate zone or in the green zone. So it's just saying that things are more stringent as we get there. So again, these data are used as one of the considerations we build and follow our plans. We work closely with our Health Services Department, and Emma Kelly, Assistant Director for Health Services, is here representing that department. And if we have any questions that are health related later on, she'll be willing to answer any of those. Okay? And so with that, I'd like to turn it over to Dr. Newman.
Thank you, Mr. Jimenez. Now, we've been working on this for quite a while, and at first we tried to do it by dates. But as Dr. Micah stated, we can't have these definites. We have to have the flexibility to operate, to maneuver with our Metro Health guidelines and the current state of affairs. COVID-19 exists in our community and our world. Our schools do not exist in a bubble, and we know they'll most likely be impacted by COVID-19. NEISD doesn't get to choose whether or not we deal with COVID-related situations. What we are able to choose is how we respond, and we have chosen to create a plan that will allow us to address situations as soon as they occur. A quick response will allow us to impede the spread of COVID-19 and lessen the impact within a school. This may mean classes will have to quarantine at times. It may even mean a school may have to close for a few days. When these situations occur, it doesn't indicate that the district has failed to create a safe environment. Rather, it exemplifies the extent in which we're willing to go to maintain a level of safety for our students and our staff and assist in slowing the spread within our community. Now, as a reminder, here are the considerations to which we referred to as we were creating this plan. At the start of this past summer, our principals were preparing to have staff who would teach virtually and staff who would teach in person. We wanted to accommodate all of the requests that we got, so that was the plan. And utilizing not only the input I described earlier, but also working with various departments here at central office, we determined it would be best to bring students back in phases, bringing them in small groups or pods of students with each phase. Now, as you can see, these phases can be used in conjunction with the Metro Health School risk levels, and we can operate within those levels as needed. We included the school closure in the first block, indicating where we were last spring, and we do not want to go back there. We're currently actually between school closure and phase 1, with our first 3 weeks of instruction being at-home virtual instruction. Now, we've outlined 5 phases for you with which we will proceed. We anticipate the first phase beginning September 8th for most schools, with an earlier start date for Castle Hills and ACE since they started school earlier. The first phase will be to allow 5 students into every teacher's classroom, at which time they will still participate in the virtual instruction. Now, this means that these 5 students and their teacher will be grouped together throughout the day in these pods. At the elementary level, the teacher will be doing the actual instruction to the whole group virtually, 5 of whom are now in the room with their devices instead of at home. And it's important to note it will be virtual instruction. At the secondary level, students will be in their home room using their earbuds or headphones to go through their schedule. The reason for the virtual instruction is because as we worked through this, it is very difficult for a teacher to have a classroom that's virtual and be monitoring those kids as well as trying to teach the kids who are there in the room. Also, we're limiting it to 5 students in phase 1. We have put an asterisk in front of the instruction, the virtual instruction, because there will be exceptions to this. And some exceptions are our special education classes, some of them, and some of our secondary CTE courses that do require the in-person instruction. Now, as I was explaining this to a couple of principals, their immediate question was, well, how are you going to identify the students to bring back? And I want to assure you that we've included that in the very next slide. So let me get through the phases and then we can get to that. I also want to remind you that the schedules that you may have seen posted on the district website build in breaks, a lunchtime, recess, and asynchronous instruction so that our younger children are not in front of the computer the entire time, and they will be following this schedule. When we move from phase 1 to phase 2, you see we're now allowing 10 students in every classroom. We progress through the phases in groups of 5. As you saw, we had a different range from campus to campus of parents who chose in-person versus virtual. So it's entirely possible, as Mr. Jarrett stated, that when our smaller schools start with the groups of 5, they may have already met all of their in-person requests. An example to this is Delview surveys came in with the lowest percentage request at 26.7%. This equals 110 students. Delview's classroom capacity for 5 students in this phase would be 180 students, whereas Hidden Forest had the highest number of percentages for in-person at 61.8. They would reach that level in Phase 2, at which time 420 students would be allowed on campus. Johnson High School had 53.3 requests in person. They could accommodate all of those requests in Phase 3. However, with the groups in the first 2 phases limited to 5 or 10, we are going to wait until our teachers who have been identified to eventually be teaching in person or virtual are no longer having to do any virtual instruction. They need to be able to focus totally on in-person instruction. We anticipate that by the time we are in Phase 3, most of our students, or most of our schools, will be able to adjust to that original plan they had created of teachers teaching a class either in person only or virtual only. But we have to remember that parents do have the option to change their mind about in-person or virtual. So these numbers are flexible, and we have to remain flexible. Now, as Mr. Jimenez will explain in just a bit, each phase will remain intact for a minimum of 2 weeks. If we're able to move through these phases successfully without having to pause or quarantine, it's possible that Phase 1 could run from September 8th to September 21st. And then we move to Phase 2 from September 22nd to October 6th. Phase 3 from October 7th to October 21st. I do want to point out that we do have some additional guidelines at the bottom of this chart. The NEISD Back to School Safety Plan for parents will be followed, and the folks here will be highlighting some areas in the safety plan. Athletic practices and contests will be conducted following safety protocol and guidance provided by NEISD, UIL, and TEA. When possible, students who return to in-person instruction, we will try to assign them to the teacher of record they had during their at-home virtual time, but that may not always be possible. And as I stated before, exceptions to the above guidelines may include special education classes and those courses that TEA has recommended be in person and NEISD has identified. I'd like to stress a couple of points again because they are so important. We need to proceed slowly and cautiously so that we can try and avoid the need to close any of our schools or classrooms, which will further impact our families. Secondly, as a reminder, our younger students will have various breaks throughout the day, recesses, lunch, and independent activities built into their daily schedule to avoid large amounts of computer screen time. So how do we identify those students who will be phased into the campus? We are going to have parents fill out a Skyward questionnaire, and of course with name and grade, and then the questions will be, is your child currently receiving any special program services such as special education or English language learners, etc.? If yes, then the defined accommodations may drive which students return and when. Another question, are child care issues interfering with your ability to go to work? Yes or no? And then are there any other circumstances you would like us to consider? And that will be open-ended. Based on the responses we receive, the first priority will be to those students whose defined accommodations cannot be met virtually. Second priority will be for those with child care issues. And should there be more requests than space available, remaining seats will be determined by a lottery system. And at this time, I would like to turn it over to Mr. Villarreal.
Good evening, Madam President, members of the board, Dr. Micah, and guests. The way we're going to do this phase-in is, I think Mr. Jimenez had mentioned 3 metrics, but we're going to look at 6 metrics that we'll be evaluating. 3 are going to be the community health metrics, which are positivity rate, the doubling time, and the 2-week continuous decline in COVID-19 cases. The three district metrics that we'll be using will be the active cases in district as percentage of employees and students currently COVID-19 positive, in-person student health-related absence rate, and employee health-related absence rate. And at least 14 days is required in each phase before considering moving to the next phase. I want to commend Emma Kelly and Maria Perez and Dylan Haycraft. They've been tracking a lot of our numbers since this first took off back in March. We do contact tracing. There's an employee website where they can go and put in their numbers, so then we can go ahead and check with those employees to see how they're doing. So we're planning to keep on doing that, and we'll be evaluating the metrics to determine the next phase in. And with that, I turn it over to Mr. Clary.
Thank you, Dan. Okay, you know, the pandemic has definitely magnified and put a spotlight on cleaning practices and the importance of our custodial operation. It has also caused us now for all of us to become custodians, because we simply can't just rely on a few to be left to the duties of disinfecting and other duties. To aid in this effort, in the last few months, we've been working to retrain our custodial staff on disinfecting procedures, and we will be providing to our classrooms and to our teachers a bottle of disinfectant for them to use. Our chemical provider is Ecolab, and you may recognize that name because they are one of their big areas that they support is healthcare. And so we've been using Ecolab for several years now, so it really was a good thing that we have been using them, because the product that we have is hospital grade disinfectant, and it is EPA and CDC approved. As part of, back in March or April, when Dr. Micah saw that this was something that wasn't going away, we spent several $100,000 on purchasing electrostatic applicators for this district. I think I've shared with y'all before what that means. It mists the air and the particles attached to surfaces. But because of this equipment, and we purchased a machine for every campus in this district. Because of purchasing that equipment, if we need to rapidly deploy that equipment, we can actually disinfect a classroom in 5 minutes, and in some case less than 5 minutes. So it's a very important piece of equipment that we've purchased because it will help in our aid of disinfecting when it's needed. I'm not aware of any cafeteria in this district that was designed or built for social distancing. But as a result, the campuses may need to use other areas for students to eat, which may include outdoor areas, a large conference room or a large multi-purpose room. One thing we're doing for breakfast this year that's different is we're doing a grab-and-go option. So students will be able to come in, grab a bag, and then if the campus so chooses, they can then go to the classroom and eat their breakfast that morning. Or the cafeteria will still be available if there's adequate supervision. But that is something new this year that we're doing to just get kids into the classroom as soon as or as quickly as possible. We have always had a robust cleaning program for our cafeterias in between lunch groups, and that will continue. But we've also installed hand sanitizer stations in our cafeterias for the kids, students, and staff to use before and after each meal. We've also been installing distance stickers in our cafeterias for separation going through the line. And in the past, students have entered their ID number into a system. Now we'll do that either with scanning the code, or they can give it to us verbally. So just one less thing that kids will have to be touching before they sit down for their meal. Okay, next one. Transportation, again, like cafeterias, the buses weren't designed for social distancing. And because of that, we're going to require, every rider to have a mask to get onto our bus. Now you're going to ask, well, what if a student shows up at the bus stop and doesn't have their mask? Well, we will have a supply of masks on our buses. We're not going to turn away any student that doesn't have a mask to get on the bus. We're not going to leave them at the bus stop because they did not bring one with them. We've also installed hand sanitizer stations on our buses. We've instructed our drivers that you will disinfect the bus before the route, and you'll disinfect it again after the route. We'll open up a few windows of the bus if weather's permitting. And we really don't know at this point how many students are going to take us up on riding the bus. So we're assuming that we will have all routes operating at this point. But as we get into a week or two into the year, we'll be able to at that time go back and look at where we can possibly collapse a few routes, and if we have some buses that have more students than what we're comfortable with, and potentially we could add some additional an additional route to that area. But we won't really know that until we get in to see how many are riding our buses. Probably over the last week or so, or a couple of weeks, you may have read articles concerning HVAC systems in schools. Just first, let me say that our mechanical systems in our district are very complex, and what may be good for healthcare, or may be good for a certain area of the country, how it was designed, doesn't mean that it can be applied across the board. This week I met with 3 reputable mechanical engineering firms, as well as members of our construction management and maintenance department, to discuss this situation. Not one of the engineers said that they would classify our mechanical systems as inadequate, as alluded in some of these articles that have been put out. We have been very fortunate in this district since 1995, since the 1995 bond, that we've been able to upgrade our systems through the years. So just because the school may be 50 or 60 years old doesn't mean the mechanical equipment is 50 or 60 years old. We also had the 2009 Q bond, where a large portion of that bond we took to repair, replace, and upgrade chillers, boilers, air handling units around the district. So does that mean we just, one of the statements that really kind of hit me, that took it home for me from the engineers, was that school mechanical systems were not designed for sanitation like in healthcare, just not designed for that. So what does that mean? Does that mean we sit back and do nothing? Well, of course not. Do we maintain relative humidity between 40 and 60%, like as recommended by ASHRAE? Well, yes, we do. ASHRAE is the American Society for Heating, Refrigerating, Air Conditioning Engineers. I didn't even have to look at my notes on that. Thank you very much. Thank you. Do our systems bring in outside air? Yes, they do. But one thing, when you're in South Texas, bringing in outside air is not just as simple as just opening it wide up 100%, because as in today, when it's 102 degrees outside, you start flooding the school with that outside air such as that, then your systems will never catch up to get it to where it would be a comfortable temperature. So, and it also brings in outside allergens and other things that that go along with that. But we do bring in outside air with our systems, and that's another recommendation that ASHRAE has. And so what else can we do? We are exploring upgrading filters with higher MERV rating. And if you're familiar with what the MERV rating is of a filter, when you go to Home Depot and you buy a filter and you see like a big 7, 8, 10 on the outside and it says 10 MERV, well that is and I'm gonna have to look at that's the minimum efficiency reporting value. Thank you very much. That's the minimum efficiency reporting value. And that just tells you how much that filter, the size of particles that filter is going to capture, okay? And so the higher filter you put, or the higher MERV number that you put in a system, say for instance in a hospital setting, they're going to have a MERV rating from a 13 to a 17 or 18, which then you're getting up into the HEPA filter size. So it's not always as easy as just going out and replacing your filters, because some of your systems were not designed for a higher MERV rating, because it requires your systems to work harder. You may have to change the filters more often. So it's something you don't just rush into to doing. It's something that you need to study. And as well as as well as the filters, but we're also looking at one recommendation that ASHRAE had was to purge our systems each morning, and that's simply turning on the systems a couple of hours before occupancy of that building, and just get things moving, so it's not just hasn't been sitting overnight. So we're looking at that to see how that would impact our systems, as well as the electrostatic sprayers that we have purchased. We received confirmation from our supplier the other day that we can use those to spray our filters and to spray our systems when we change our filters. And in a district the size of Northeast, we have probably close to 65,000 air filters in this district. We have crews that is all they do, is go around changing air filters in this district. So we are looking at how we can do things better, how we can improve the filtration in our schools. But like I said, it's just something that it requires some time to look into. To end with this, 3 of the 4 engineers that I met with this week have kids in our facilities. And I asked the question, would you send your kids back to school in our buildings? And all 3 said they will be sending their kids back to school in our buildings. So I thought that was a nice vote of confidence from those that work in the field. So at this time, I'm turning it over to Mr. Villarreal.
Thank you, Roland Del Clary. All right. Student staff self-screening. Dr. Micah mentioned this earlier in his talk. This is one of the #1 most important things that we can do for students and employees. They're expected to screen their students for COVID-19 symptoms each day prior to sending their students to school. Staff is also expected to do the same, and you've probably seen this list over and over. Cough, sore throat, shortness of breath, loss of taste or smell, chills, diarrhea, repeated shaking with chills, feeling feverish or temperatures greater than or equal to 100. To know those symptoms is really important, because we're going to be putting signage in front of the doors when somebody comes in and checks in in the vestibule areas. But known close contact in the last 14 days with a person diagnosed with COVID-19 or anyone in the household who is displaying COVID-19 symptoms. It's going to be really, really important. I mean, if we take anything out of anything, we have to make sure we self-screen. Face coverings, the state of Texas sent us 7,900 face shields, 406,000 surgical masks, 104,500 non-medical cloth masks, 317,000 kids masks, student masks, medical gloves of 269,000, and 6,824 individual gallons of hand sanitizer without the pump, and 483 medical thermometers. What we ended up doing, we parceled those out and sent to the campuses. We sent out 1 adult cloth mask per campus staff, 2 adult cloth masks per student at the high school level, and 1 face shield per campus staff at the high school. Middle schools, 1 adult cloth mask per campus staff, 2 adult cloth masks per students, and then 2 child-sized cloth masks for the 50% of the students who might need a child mask, and 1 face shield per campus staff. Elementary schools, we sent out 1 adult cloth mask per campus staff, 1 face shield, and then 4 child cloth masks per student. So that takes us to the face coverings. Schools are expected to comply with the governor's executive order for wearing face coverings over the nose and mouth. This applies to any person 10 years of age and older. In addition, students of all ages will be required to wear some type of face covering except when social distancing is possible and when participating in activities that cannot be conducted with a face covering on. An example of this would be during lunch breaks with appropriate social distancing. Another exception for students younger than 10 may be in the classroom when students are appropriately isolated at their desk, utilizing distancing measures. Face shields will be allowed as long as they are worn along with a face covering. That has come up quite a bit. Face shields the requirement is you have to have a face covering, but you're also going to have to, if you want to use a face shield, you can't just use a face shield without a face covering. You have to use both if you're going to use a face shield. All students are required to wear face coverings when riding the bus and during the school day. Students should provide their own personal face coverings. The district will provide a face covering for those who need one. Students will need to wear face coverings anytime they leave their classroom, such as when going to the restroom and anytime in transition. We're ordering some more of those face masks, face coverings, so we're going to try to keep those stocked up in the warehouse in case we run out at the campus level. And with that, I turn it over to Ms. Chancellor.
Thank you. So as Dr. Newman mentioned a little bit earlier, we know that COVID-19 is in our community, and we also know, unfortunately, that will likely impact our campus at some point, one or more of our campuses. And so it's how we react to that, how we handle the situation, and how we move forward from there. And so a big part of that is communications. I know that a lot of parents have asked, what will happen if someone in my child's class comes down with COVID? And so we want to reiterate from our safety plan, our protocol, and what our expectations are. So if a student or a staff member is diagnosed with a positive COVID-19 test, we are going to let every single person at that campus know. So that means if it is a child in whatever grade, we're going to let all of the parents at that campus know. We're going to let all of our staff members at that campus know. Of course, we will use our privacy guidelines. We will not identify that student in any way, but we will let everyone at that campus know that yes, there has been a positive COVID-19 test at that particular school. So we also want to let our parents know that we're going even a step further than that. As mentioned in our safety plan, you may have seen and been familiar with that in the event that someone shows symptoms at school, we don't know what it is, but we know that they're showing symptoms that could be COVID related. That student is going to be removed, isolated, assessed by a nurse immediately, parents called, and the remaining classmates in their pod will be removed from that classroom. They will be taken to another location so that immediately sanitizing of that classroom can take place and disinfecting of that classroom can take place. You heard Mr. Clary say that if they bring in their electrostatic applicator, that can happen in a matter of minutes. But we don't want children to go home and tell their parents that that happened to them without their parents knowing. So we're going to go a step further, and if that does take place in a classroom, everyone in that particular classroom will be notified that they were removed and that there was someone showing symptoms and that the entire classroom was cleaned. Because again, our goal is to be as completely transparent as possible. We want everyone to have the information that we have, and we want to move forward from there. That's the communications plan. So I'm going to turn it back over to Dr. Newman now to finish up our presentation.
Thank you, Ms. Chancellor. Sorry. The waiver requirements you see up on the screen come from the TEA website under coronavirus updates in the attendance and enrollment section. As you can see, it does state that the district must request a waiver if we intend to extend the start of the 2021 school year beyond the initial 4-week limit. And this brings us to the end of the presentation. It is our recommendation that you approve the plan as presented to include the required TEA waiver for an extension for an additional 4 weeks. And at this time, I'd like to turn it over to Dr. Micah.
Before we turn it over to you all for questions, I just want to take a few moments. One, to thank the executive staff. Y'all, we have done nothing but work on this now. I can't even count how many hours. They've stayed late. They've reached out to their people because this has been a huge lift for everyone. This took really everyone working together in a very real way to get where we are today with this plan. I also want to thank our Human Resources Department. They have had hundreds of people looking at FFCRA, FMLA, ADA leave, and they are working. They were up here on Saturday processing requests. It was their recommendation and Dr. Newman's that this week what we did, because we were backlogged, we allowed our employees to work from home this week until we could process it. So they took that extra step and just said, I know, I realize it, let's go ahead and let you stay home until we can process it first, and then we'll give you a final decision. We've started school already. Our teachers are back. Castle Hills and Ace are well underway. And then in every campus, we've had people back. I cannot tell you how extremely proud I am of what I see out there. The smooth processes for passing out devices, hotspots, the extra efforts that everybody is taking at that school. You may have seen on different news channels some of our teachers featured, talking. Y'all, they are excited to welcome our kids back. They are excited and eager for that moment. Our maintenance department has continued to work to try to do everything within their power to get things done. Our transportation employees, even though, we're not going to be running buses, but we're going to give them an offer to go out and do some things and work and continue that we can pay them through this piece as we scale up. I also want to thank Jennifer Gutierrez, Susan Diaz, and Anthony. We are one of 5 districts in the state of Texas that has had their asynchronous plan approved. I found that out the other day, and we had really no idea what a big deal that was until today's TEA's superintendent call, because most of them have been filed incomplete or denied. Ms. Gutierrez today, I went down to see her in her office to congratulate her, and she was on a Region 20 call with, I don't know, probably most districts in Region 20, talking them through how the process that they use to get this done. So kudos to them. And I'd like to leave with this. As the superintendent, I have no idea, y'all. I have none. I don't know how this, whether I overreacted. I don't. I have 2 of my own kids in our schools. But I can tell you one thing I do know, because it won't be obvious to anyone down the line if I overreacted, but it will be very apparent that I underreacted. And every night I go home with 64,000 students and 9,000 employees on my mind. This plan, I feel, is the absolute safest plan that we can construct for our employees and our students by listening to all of our stakeholders and not just one singular voice. I turn it over to you all for questions.
If I may start off, thank you, Madam President. I was writing down, well, first to the group collectively, thank you. It was a very, very thorough presentation. And as Dr. Micah said, I can only imagine how many hours this took for you guys to come up with. Ms. Gutierrez, congratulations. With over 1,000 school districts in the state, to be one of 5, I'm very proud to be associated with you, so congratulations. But so I'm just going to take this by presenter. And so my first question for Dr. Newman. I think you mentioned that as we move forward with the phase-in process, God willing, we're going to get to a time where all or most students are back in school. If I started out with a teacher virtually, and they decided that they wanted to be an in-person teacher, is it possible that I'll have a change? Is it possible that my teacher originally can change?
Yes, it is, because as we move closer to opening it up, then the principals will be able to go to their original plan of these teachers are doing in-person, these teachers are doing virtual.
Okay.
Through the first 2 phases, all of the teachers are going to be doing virtual. So that means that as groups come back, they will need to be placed with every teacher. So you might have a virtual teacher who had a class of 20 students, but 5 kids are going to have to be in a room doing the synchronous instruction with their assigned classroom teacher. So when these kids come back, it's dependent on who the principal's identified as teaching the virtual.
Okay.
Because you could have an in-person virtual designated teacher, and then when we start with the in-person, the virtual, that child will have to be moved to those teachers doing in-person.
Okay, thank you. My other question was for Mr. Clary. And one, again, I'm going to, congratulate you and just the team for the foresight in purchasing a lot of this equipment before we left on spring break last year. But in your best estimation, how quickly could we sanitize a high school if we had to, if something unforeseen happened and we just said, hey, you know what, it's probably wise to sanitize the whole.
Right. If we had a large area like that, we'll definitely have the capability of bringing in more equipment from other campuses and bringing in other staff. So we wouldn't just rely on just what they had on the campus to disinfect the whole campus. It's really kind of designed for just smaller areas at a time. But we could do a high school easily with enough people in just a matter of a few hours, at 5 minutes a classroom or less. We use 5 minutes, but it's really just you're walking through a classroom spraying. And the most time that you have to spend is when you have to refill the equipment over time. But if we have a large area that needs to be done, then we're definitely going to be bringing in from other areas to support that school.
Okay, and then just following up, so at each campus, is there going to be someone designated that knows how to use the electrostatic?
Yes.
Okay.
Yes. We've for sure the head custodian has been trained, if not already been trained on that, as well as other custodians. It's really it's really not high-tech equipment, I guess you could say, to use. So we will be able to train several people on that to use it.
Perfect. Thank you. That's all I had at this time.
I have questions. Okay. Hello, everybody. Hey, Tony, I'm going to follow your lead and do as presenter. Anthony, Mr. Jarrett, I do have a question for you based on the survey. I just wanted to make sure that that the parents that answered that they did want in-person instruction, they had to answer as well the component about the internet and the devices. Because if we do have a micro closure, they will then need to be virtual learners. So that piece, they were included in that piece. Is that correct?
That is correct. They had to answer the question on which learning platform they would like to use, and then if they have technology at home as well as internet.
Okay, thank you. And then Dr. Newman, I'm not sure if I missed a piece. I saw that in our presentation that when it talked about phases, you said 5 students and then you went to 10 students. Was there something that I'm missing? Did I miss a piece?
No,
that
ma'am, you
contained-
didn't. I did not go into phase 4 and phase 5. I did state that every phase would have an increase of 5 students. So phase 1 is 5 students, phase 2 is 10, phase 3 is 15, and phase 4 is 20. With phase
Got it.
5 being we are free to move about as we want.
Okay, thank you. And then Mr. Clary, I did have a question. You talked about stickers for social distancing. And my question is regarding stickers on the floor, our hallways. Do we, I don't know whether in the different phases if students will be moving about the building, but if they're going to the cafeteria, I'm assuming so. So are there designated hallways that would be one way, or how do you avoid having, we've seen them on social media and on the news where there are multiple students going in multiple directions. How do you control the hallway traffic?
If I could just take that for a minute, Mr. Jarrett can
Yes.
actually answer that. He went out and visited a school today to determine if the hallways were wide enough to accommodate one-way traffic.
Okay, yeah. So they are. No, I did. I was talking to Dr. Newman earlier. I'm a visual person, and so went out to a campus site, and it was a high school in particular because the volume of kiddos that will walk that hallway. And visiting with that campus principal, they are working very hard to create an environment that creates one-way traffic down one hallway, and so that way kids are not crossing paths with each other. In the spaces where that could not happen, they're actually assigning administrators to those site locations so they can encourage the kids to move along, but also maintain the fact of them having face covering. And so the hallways are wide and the campuses are very large. They have also already started thinking about what the cafeteria plans look like. So kudos to those campus principals. They are truly leading their campuses and their communities, and so I applaud them for their efforts.
Thank you. I do have a question regarding the mist and surface, the cleaners. I've lost the name of it. Mr. Clary?
The electrostatic applicator.
Electrostatic cleaners. So we did have a question within the last couple of weeks about, you had mentioned that it mists it in the air and cleans surfaces. Does that mean that it gets airborne? If anything is airborne, that it will catch that as well, or is it just mainly for surface use?
The science behind it is that it attaches to surfaces. It's really for surface cleaning, not really catch what's airborne, because with the charged particles, it attaches like a magnet onto a surface.
Okay. And then for best disinfecting, what does that look like? Is it with a towel and a spray with the, that hospital grade spray that we have, just per seat, or how does that look?
Yeah, spraying, it's simply spraying a surface and wiping the surface. With the disinfectant. The disinfectant is a hydrogen peroxide based cleaner. And actually, some of your, like if you go to H-E-B and buy some disinfectant, you could have to, with some chemicals, leave it on the surface for 10 minutes, dwell time. Our product is less than a minute. So great. that also allows for more rapid cleaning, disinfecting. You don't have to let it sit there as long. But it's simply spraying. We've purchased thousands of spray bottles that are labeled with the product. Our custodial staff will be refilling those bottles as needed, and we have all of the data sheets on it should we need that. But it's simply spraying and wiping and moving to the next area.
Thank you very much. And then my last questions are for Ms. Chancellor. When you talked about removing it, should there be a case or a symptom, a child shows symptoms and they're removed from the classroom and then the classroom is disinfected, do they remain in the holding room or do they go back into the classroom? And then there's a second part of that. With the COVID diagnosis, do we do any contact tracing on our side?
Yes, ma'am. Great questions. Each campus is going to have a designated area so that it may look different at each campus where those children are going. They may go for a walk outside. They may go to some room that is empty for them for a moment. Again, it's going to be quick. They won't spend a lot of time outside of that classroom, but once it's cleaned, then they will go back inside. They will not go to another area where any other individuals are, as to not mix. You want to keep that pod together. As far as once we do receive a positive COVID-19 diagnosis, the first call is going to be to Metro Health, of course. It's also going to be, I would say, the first call, but 1 and 1A is going to be our NEISD Health Services right after that. And yes, they will be doing contact tracing from there. So they've actually received hours and hours of training over the summer from Johns Hopkins University. They know exactly what to do. They know the questions to ask. And the one very important thing that I did neglect to say earlier was if you do receive that letter that says that someone on your campus does in fact have a positive diagnosis, once that happens, if you are someone who has been considered in close contact with that person, you will receive specific individual communication. It will not just be that letter. And in that letter, we will let you know if you are someone who needs to have a little more information, you will get that call. So that's how you will know if you need to quarantine. That's how you will know if you need to go virtual the very next day, and that sort of thing from there.
Okay, thank you. You, Dr. Micah, your staff has done an amazing job. I'm so proud of everything. They were very thorough, and it just, like, once again, I'm without words. They're just amazing. Thank you so much. Great job, guys.
And I'm sorry, I probably for the record needed to state that Mrs. Winkley is virtual. You know.
And I'm healthy. I just traveled. I traveled. That's why I am at home. I'm
But
healthy.
it's so cool looking at you on that screen. Okay, questions? Yes.
Okay, I'm probably not as organized as y'all with keeping it, so I may skip around a little bit here. But Mr. Cleary, in the cafeteria, you did show a picture of one campus where the seats were X'd and things like that. Recently, there was another district that was sharing their plan, and they had opaque dividers. It looked, I personally didn't care for it. Are we going to have anything like that? Physical dividers in the cafeterias on the tables?
Our recommendation is, now, Mr. Jarrett can speak on we have purchased some dividers for the classrooms, and some will be mobile where they can take them with them if they want to. I'll let Mr. Jarrett speak on that in just a moment. But the zigzag pattern that we have recommended to the campus and that's one of the reasons why they may have to use other areas, because now you're sitting here but no one's in front of you, you know, and so it's going to take more space in order to do that. But that way wouldn't necessarily, you don't have somebody right in front of you. And so we have suggested that be the way that the kids sit in the cafeteria. Mr. Jarrett can talk on the dividers if he doesn't mind.
Okay, so we ordered some dividers for our kiddos in grades second, first, kinder, and pre-K, mainly because the governor's orders that those kiddos don't have to wear masks, but also the reality of it is they're probably going to take them off and throw them at people. And so our effort is to still maintain that security and safety of all the kids. And so those younger babies, we got the desk shields for them, which actually have a little handle that they can take to the cafeteria with them as well, and they can sit down and eat, and they can maintain their safety.
Are they clear plexi or are they?
They are.
opaque?
They're clear, but they're like in a little. I don't know how to
frame?
explain. It's a frame, yeah, and then there's
Right,
glass so
okay,
you
I've
can
seen
see
those
the person
pictures.
and everything like that.
Perfect, okay. Oh, that'll be fun.
Glitter.
Oh, no, not glitter. Not glitter. Our wonderful maintenance staff has enough to do already. Okay, back to, I guess back to Mr. Clary. On the issue of providing, on the bus service when we do get to actually be physically moving back to our campuses, and the recommendation was to provide, we were gonna encourage parents to provide their own transportation from a safety factor. I get that, and I think that's great, but, what is that gonna do to the drop-off lines?
Oh, no,
good.
that definitely has been a conversation. It's going to add more to the drop-off line. And we know that even without us recommending that, there's going to be an increase in, but we also have to look at the percentage of kids that we're bringing back at a time that hopefully it won't be something that won't be manageable, that will be manageable at the campus because of fewer, the percentage-wise of kids being on campus.
Right, Ms. Huey, just remember at 5 at a time, you've minimized that, which also allows,
Right.
if that were a problem, see this phased-in approach allows our administrators at each campus to monitor and adjust and not have to do it so rapidly, but really think it through in a very purposeful way. So as we continue to scale up, that those systems are in place to handle it at scale.
I love that. That's just great. And, Mr. Clay, this is really kind of just a curiosity question. As you talked about all the filters and the this and the MERVs and all your little acronyms, you're so impressive. So impressive. I've got one for you. UV. Let's go with UV.
Okay.
There's a lot of talk about that some buildings, corporate buildings, are putting in the UV lights on their filters. I know I have friends that have done it in their homes even. Is that something that could be done, should be done?
It's something that, and I didn't put that down, but it is something that we are exploring. But it's another thing that's just going to take some research. One thing I didn't mention is, in a district our size, the number of air handling units which is where you put the UV lighting in the air handling unit. Mm-hmm. We have a range from 8,000 to 10,000 air handling units in this district. So it would be a large scale operation for that to happen. They recommend, of course, that you put it on in the HVAC equipment. Because there's been some folks that have tried to sell it for inside the classroom, but there's studies that say that that's not good for inside the classroom. But it is something that we continually look at to see if it's something that would work in our district.
Okay. Well, in this,
Ms. Huey?
Yes, sir.
I probably receive, and Mr. Clary probably receives,
Lord.
20 emails a day with this
We do too.
is the perfect thing for
Yes.
this.
Yes.
Nobody is going to let a good pandemic go to waste to try to capitalize by selling something. And honestly, in some ways, it's like snake oil salesmen. It is, and they're like this new thing out, and then when Mr. Clary and his staff have been really good about researching all of these, and then when they say, oh, this is all research based, and when you look, either the company has done their own research,
Yeah.
or there's really, there was a study and it's really not been replicated over time.
Dr. Google helped them on their
I mean,
research.
so
yeah.
we've got to be so careful because you see things out there. This will do it, but when you research into it a little bit more, I'm not sure that's what we want to do. And so we're just trying to be very purposeful and not just jump at things. You see this all over. Mr. Jarrett sits on UCC, and they spoke about, and he said it is scary how wide people have gone with some things, and there's really no basis for it other than we don't know what to do, so let's do something. And what we're trying to do is let's do the right things so that we know that they're effective.
I think my comfort level in these situations is to rely on the experts, and to me, the experts are the people sitting right here that have, they've done the work, they're in the field, their priorities are proper, are right, are what we all consider. If I need a medical expert, I'm going to talk to a doctor, not social media. If I need a legal expert, I might call a lawyer. I don't know. Mr. Lopez isn't here. That was a wasted line. But I have children that are attorneys, so I can't go there. But if there's an education issue, I'm going to turn to an educator, a real one, a true one, who's got the best interests of our children. So thank you for not listening to the snake oil people, because the board is getting those emails too. I guess they're desperate. But that does bring up an issue, and someone might need to hold down Mr. Villarreal when we're talking about all these filters and everything else and the financial impact on our district. None of this stuff is cheap, whether it's the electrostatics, whether it's the additional cleaners, whether it's no matter what. How is that going to hit us on the bottom line?
Yes, Ms. Huey. Some of the things that we have been purchasing are going to be reimbursable either through the state or through FEMA or through the other funding sources.
Eventually,
yes, ma'am.
yeah.
Hopefully, Dr. Micah had gotten some news today from the commissioner talking about maybe reimbursing by October. There are some costs that we are not generating and having some savings in other areas that we might be able to cover those costs. Like tonight, we're bringing to you, hopefully, approving of those shields, desk shields. And some of that money we were able to roll over from the prior year. So, we monitor it every day. We're looking for different ways to be able to save. And I think, financially speaking, I think we're doing pretty good, actually. Our collections are good as far as our property tax collections, and we get most of our revenue through that. So, the state hasn't said anything about proration, and I don't think they are. I think 2021 is going to be fine. But financially speaking, I think the way we've been tracking, I think we're in pretty good shape, actually.
We're within budget.
Yes, ma'am.
We have not exceeded the budget that you all approved.
Okay, well then
All
let's
right.
add another little piece to that financial impact though. And I think every single person in this room knows it, and somebody's gonna be buying that glitter. And we all know who it is. It's gonna be our teachers. And as I look around, as I talk to my friends around the state, and as we are, these are trustees in other districts, and as we are sharing stories of what's going on, and you're hearing things of teachers buying shower curtains for their protective equipment and things like that. Yeah, I'm sorry, but I want them to decorate those little shields too. I think that's a great idea. Not with glitter though. But somebody's going to be buying stickers. Is there going to be some type of provision? Years ago, I can remember when I was a new trustee, we actually had a line item in the budget that was named after this incredible woman who used to come to us every year and ask us for a reimbursing amount for our teachers, where our teachers could submit receipts. I hate to say that I don't know if that line item is still there. It wasn't huge. It was, Dan, don't shake your head right now. That is not what I wanted to see.
I was trying to remember, because I remember.
It was June Blum. Yes, it was June. She was an incredible lady, wonderful woman. But she would come to us every year. So is there anything that we can look at to help our teachers? I actually had a phone call today from someone who, a dear friend who reached out to me because he had been approached by some corporate groups. And they are looking for ways to help our districts, our teachers. And he said, can you send me a list of things that teachers want? And it just so happened last week I'd been compiling that for someone else. So will we be able to, I know the foundation does incredible with this type of thing, but can we, is there some way to, Aubrey, set up some type of communication to our community saying, these are things that we need? We've had high school students doing incredible jobs with homemade masks and things like that. I don't know, are those going to be okay to use? Can, if someone wants to donate, but I know several sewing groups that have been making masks for nurses, and is that going to be doable?
Well, there's a lot of questions on that.
I know.
Are we going to
No
be
way,
able
I
to
put
do
those
something
teachers up here.
for teachers? You know, if you'll recall back in June when we spoke at our budget, right, we're hoping that things work out to where we can do a 2% retention bonus. So we're focused on that. As you all know, you voted to have no premium increases, right, for health care, to keep those low. So we're trying to do things to not pass on costs to our employees. I think the Northeast Education Foundation, you know, Amy Lane's amazing.
Oh my gosh.
I think we're giving out $310,000 in grants, right? And then for the new teachers, they always give, I believe it's $100.
$50 gift cards
Or
that we just.
$50,
but-
they give
but
supply
I think we
grants.
give like
and-
200 of them or something
Yeah,
like that.
so
yeah.
there are lots of pieces in there, Ms. Hugh. You know, again, you know, we were very excited after the call today with Commissioner Morath. And look, the reimbursements are not easy because there is one set. If you purchase things from March to May the 21st, then you apply this route. If you bought things through Operation Connectivity, you apply through this route. If you're trying to get some FEMA money, you apply this route. If you bought things in between May 21st and Operation Connectivity, there is another route. Like, it's very complex. And so we sat down today after the call because the commissioner had stated to us, because we purchased a lot of things in the gap. We purchased them after the 21st of May and before Operation Connectivity because we were getting prepared. We couldn't wait on the state to help. We needed to do it, right? Well, they said, you're going to get reimbursed. Dan and I were on that phone call, and we were like, that's awesome. You know, that's going to be a huge win for the school district. Well, then it was like it went away, and we heard nothing of it. Today, he finally stated, no, we're going to reimburse you for that gap period. Now, just remember, this is never at 100%. It is never 100%. And so it's anywhere from 50 to 75%. But we feel very positive that we're going to get a fairly good sum of that money back, back into the school district. Now, it's not going to happen tomorrow. It will happen over time. You know, government never moves as fast as we want them to. But we'll get it back in. Again, we have a healthy fund balance that will help us through that period and allow us to fluctuate. But again, I want to reiterate, because Mr. Byer, you always ask that question, right? And it's a great question. Are we within budget? Absolutely. We are still within the budget that you all approved back in June. And it is our intent to stay within that budget. Now, as we all know, though, COVID-19 is just unpredictable. We just don't, it's so new, we learn something, it seems, every day or every week. So is there a potential down the road that we're going to have to make a large expenditure? Sure. I can't say it won't happen. But as sitting here today, we feel pretty good about where we're at. We were able, Mr. Clary bought a lot of those electro backpack sprayers. There's more than one at a lot of our campuses. So we're, again, trying to We've been trying to ramp up, but just not spend money, but do it very calculated where we know we can get proven methods in which to deal with this.
Okay. And then I have one other question, and this is really kind of a down the road question, I guess, but it's something that I've been asked and have been in multiple conversations about, and that's the face coverings for small children. As we're talking about, there would be extra masks at the elementary level. I can't even begin to imagine. And again, that's two sides to it. The dealing with children and keeping them in masks and the extra duty that puts on our teachers. And what do you do the first time they sneeze and you know, all the implications that go along with that. At the other end of the spectrum, I am greatly concerned about teachers having, and principals and everybody else, having to monitor what is on those masks for older children that may try to push the line on appropriateness. And I understand that's already become a problem in some districts that are back. And not here, but other areas. Anybody?
Ms. Huey, that's a great question, and I think just like any other article of clothing, backpack that a kiddo might have, we need to make sure that it's appropriate. We need to make sure that there's nothing on it. You know, we tend to, bad language, drug paraphernalia, those kind of things.
Right, yeah, the norms.
Yeah, those norms. We're going to be looking at it, so it's going to be very similar to a T-shirt that a kiddo will wear. So we'd use those same thresholds that we have for that, and we work that way. We do understand that wearing of a face mask is a learned behavior. We're going to have to teach, and so that's going to be part of the process too, especially for the little ones, is teaching that. But, you know, walking into a store, you know, you see a lot of little ones already with masks.
Mm-hmm.
So the hope is, because this has been going on for a little bit, that there's going to be some kiddos that are used to it. But as you said, what happens when the kid sneezes, and it's going to be difficult. But I think we're going to have to teach them about face masks. We're going to have to make sure that we're following the same procedures that we do for any article of clothing that they may have. And then the use of face shields or other dividers that we may have will help mitigate some of those concerns on the spread of the virus.
And again, there's just another way that our community can help us.
Mm-hmm.
Yes,
See, we're in this together.
yes.
Our parents can, with younger children, teach them the proper way to wear a mask, all of those things. Like, those are ways that we can work together to open our schools and then keep them open. Because if we're going to rely 100% on our teachers to do that, as you stated, they already have a lot to do. So as a parent, we're going to do that. Look, I have a freshman and a junior. The junior is great. The freshman, you know, we have to kind of talk about masks, right? And we do. And we have conversations about it. And what my wife and I reiterate to him is, you're not wearing it for yourself. You're wearing it to protect others. And you need to think past your own needs and focus on others' needs. And that's the message. And what he's realized is, oh, okay, this really isn't about me and my comfort level. This is about me protecting you from me. And that's where he understands it. But he's not a fan of it. He's not.
And then if I could just add something to that as well. By starting off small, with a small group of students, we'll be able to identify problem areas, I think.
Another
and
great
be
facet of the
proactive.
phase-in.
Be
Great.
proactive in identifying strategies we can use to prevent these problems from occurring in the future.
Wow. Wow, this plan just has so many beautiful facets that keep coming up. And then I wanted to echo Mr. Hasso, Ms. Winkley, and you, Dr. Micah, with thanks and gratitude to all of you who have worked so hard to take care of our students and our teachers. There's another group I'd like to express gratitude to, though, too, and that is the parents and teachers and community members who've reached out and have been positive and supportive and understanding on top of their fear or on top of their uncertainty. They have continued to support us. Maybe they're not always as vocal as some of the naysayers are, but I know some of us got some very sweet messages recently in the last few days from some moms, and there's no way to tell you what that meant to us. I'm extremely grateful for the church groups who've contacted me, I know, and probably others, asking what they can do to help us. I think that these parents and these groups have truly learned what it means to give grace at this time when we're all so unsure and uncertain about what's going on. And the fact that we are in this district is probably the biggest grace that all of us have right now. So I'm extremely proud to be a tiny part of it. So thank you. Thank all of you so much. And to all of you virtuals, thank you.
Ms. Williams?
Okay, it's time for the children's table. I just have a few questions, just for clarity, I guess. Not clarity, but clarity. Maybe for clarity. But so, okay, so it was clarified that the time period between phases is about 2 weeks. So phase one, and I'm looking at the colorful chart in the school phase-in plan. Phase 1 and 2, it was stated all teachers are virtual. Is that correct?
That is correct.
Okay, but on the chart, it says no more than 5, under phase 1, no more than 5 students allowed in each classroom.
The instruction will be virtual, so these students will be in the classroom with the teacher who will be conducting virtual instruction, and these students will have a device on their desk engaged with the rest of the class who are learning virtually with the teacher.
Okay. Okay, I guess that's clear. And then, so looking at every 2 weeks, I've looked at phase 5 being around November timeframe, maybe before.
It's hard to say because we have got to take a look at what's happening in the community.
Sure.
And phase 5 is really when we can go back to the way we had been prior to COVID.
Yeah. And Ms. Williams, I would not state any date definitively. This is a health crisis. As we've seen, right, this community did a great job for a very long time of keeping that spread very low. Things changed. We had a huge rise in COVID, and now we're on that downhill slide again. Nobody knows. There's a lot of hypotheses of what's going to happen.
Mm-hmm.
Nobody definitively knows. And so that's why we don't set hard and fast dates.
Sure.
Because situations may change and we have to scale back. Situations may improve and we move forward. That's why this is such a nimble system without saying dates, because what dates do is people believe on that date something's going to happen. Mm-hmm. We don't know. Mm-hmm. Again, we knew back in March we were going to have to close schools. We could see it coming. None of us knew that we would shut them the way we did for the remainder of the year. Mm-hmm. So who knows what's about to happen, and we have to be ready to respond to what that is, no matter what that is.
Okay, so phase 5 is really like the ultimate goal. Like everything's back to normal, no mask, no social distance, no intense cleaning, everything's good.
And Mrs. Williams, let me just state that there can be virtual instruction for those parents who chose it, as long as TEA is approving that.
Okay.
And let's hit upon that. As long as the Texas Education Agency is funding it. Because again, how many times has that advice changed? Yeah. Right? I mean, really, y'all, I'm not saying it's going to, but none of us know. Suddenly, we have a vaccine, right? I mean, look, Russia has one. But suddenly there is a vaccine, and who knows? Will they continue to fund it in March if they feel like conditions have improved? And then say, you know what, we don't care, we're gonna force you back? We don't know. Who knows, right? And so that's why that caveat is in there, is that we plan to provide it all year. But we can only do what Texas Education Agency allows us to do and counts. All right?
Okay. And so earlier it was stated, or I think on one of the slides, if there are more requests than space, then a lottery system would be used.
Correct.
So why would we, I guess I'm not understanding. If we don't have the space, then why would we consider any additional
It's an
folks at
equitable
all?
way. If we have, let's say, at an elementary campus, 20 seats for third grade, but we've had 25 parents request in person, we debated how to select the students. And all things being equal, let's say these are kids whose parents have indicated that they need school so they can go to work. Well, how do you select those 25, or the 20 out of the 25? So the lottery seemed to be the most equitable way to choose those children for the first phase and the second phase. Well, throughout, actually.
Oh, okay. We're not saying that there's only, so for instance, where we've designated capacity, say no more than 20 students, we're not saying we're trying to fit 25
No, ma'am.
in there.
No, we will stick to those numbers.
Okay. So for instance, we have guidelines, and we're seeing every parent who wants their child to be taught in person and say, they're selected. However, that parent may not want their child to wear a mask or be social distance or, follow the guidelines that we're provided, but they want in person. How do we address that?
I think we would address that the way we would any child who is possibly disrupting the learning environment, and that would be through possibly the student code of conduct.
Ms. Williams, today on the commissioner's call, we were told back in, I believe it was May, we had to release this document to all of our parents. I think it's the Parents' Rights, Educational Rights for through COVID-19, all right? And in it clearly states, for you to go to in-person school, you're gonna have to follow the school's rules.
Mm-hmm.
So if we say you gotta wear a mask, you gotta wear a mask. If we tell you have to social distance, you have to social distance. These are the non-negotiables in this. Now, there could be, based on medical reasons, a reason that somebody simply cannot, right? And so we'll have to go through and document all of those things appropriately. But these are not up for negotiation. These are the safety measures that we are putting in place. And if you choose in-person schooling, then you're choosing to abide by them. If you simply don't, and I understand that there are people out there that may not wish to, then I would encourage them to remain virtual. Again, Castle Hills has been doing it, and ACE has been doing it now for a while, and it's going very well. In fact, I read a post the other day of several parents saying, I actually am now wanting to go virtual based off of what my friends are telling me from Castle Hills. I think, again, and I guess I would describe it like graduation, right? When we were faced with creating an entirely new graduation, there was a lot of angst around it, because the only thing we could imagine is what graduations had always been. And it was so hard for all of us, my staff included, for us to envision something other than this large gathering. But then we created something and we explained it, and people were still having anxiety about it. I mean, you guys remember, right? And then all of a sudden they came and did it. And then they were like, hold on, that's actually really nice. I didn't have to pay for parking. I didn't have to sit in the Freeman for 3 hours. This was actually really neat. What a great experience. But see, it was difficult for people to embrace it because they didn't experience it. I think as people experience the new virtual learning, I think they will see, look, and I'll be honest with you, my wife is anxious about it. Because what she experienced in the spring is her frame of reference. Mm-hmm. See, Mr. Jarrett and Miss Gutierrez and Miss Diaz know that isn't going to be what they're going to get. Mm-hmm. But until we experience that moment and go through it and go, hold up for a second, this is actually pretty neat. Mm-hmm. I think that's going to be some of what we're going to find, mm-hmm. right?
Mm-hmm. Thanks for the reminders, because as you spoke about graduation, I'm reminded of the of the emails that we got for in relation to that, where everybody had an answer to what we should do, because this school is doing that. Why don't we do that? Or this, or we could do that. So the same thing here, now recalling, of course, we're getting more emails regarding our plan here. And I remember, one in particular that said, I want things the way it used to be. I want in person, but I don't want my child wearing a mask. I don't want my child being social, and I don't want this. I'm like, really? But okay, so that's good. We have a plan. Just a few more, and this may be for Mr. Clary this time. I know you were talking about breakfast and lunch and how the kids would be social distance and things like that, and and maybe they can have the grab and go breakfast and take it back to their classroom or some other part. And I know we've always been concerned about other parents that may need assistance regarding meals. So if there are those that are virtual, could they come and pick up breakfast and lunch for their kids?
Yes, we will be providing curbside for virtual learning with the meals. So we'll be doing both. We'll be doing in the cafeteria and a curbside for those that are virtual.
Okay.
But now, what we have to remember is that right now the program is totally, once school's in session, it is totally different than the way it was back in the spring and the summer, because no longer, unless you're at a campus that has the community eligibility provision, you don't just get a free meal like we did back in the spring and summer. Now it's back to
those that are eligible.
Like if you're back in school again. Mm-hmm. So, in other words, a child from Northside can't come over and pick up a meal at one of our campuses now because of that. We're back into school rules. Mm-hmm. But yes, we have been providing an option at Castle Hills since the day they opened for virtual learners.
But Mr. Clary, why don't you share with them how we've had to adapt already based on what's going on there?
Yeah, we, thanks to Sharon's leadership, we've really had to look at some things about how we're doing business. And when we were the first week or two at Castle Hills, we were not getting participation at all because it was during the day, and I'm sure there were some parents that were working and couldn't make it. So we are, and I believe it's starting on Monday, we are providing meals that you can pick up in the evening from like 4 to 5, 5:30, somewhere around in there. So hopefully we'll be able to capture some of the parents that are on their way home from work. But that couldn't. So, in other words, that evening you'll get a meal, you'll get a breakfast and a lunch for the next day. Come back the next day. Unfortunately, it's not. We can't load you up for a whole week like we did in the spring, but we are adapting now, and we'll have to keep adapting, because we may get into, once we're back into session, once we have in person and virtual going. we'll have to look at, we may have to set up hubs instead of just doing it at every campus. But there will always be that option, as long as there's virtual learning, there will always be that option to pick up a meal.
And so it's available.
Yes, ma'am.
And so, kind of changing subjects here, you also mentioned buses. When will those start running?
We'll start running on day one of in-person learning. Whenever we start back in person, they will be running. Now, right now, Dr. Micah mentioned that we have reassigned some of our transportation staff. Some of them are coming over to help our custodial services in the meantime. Also, we also still have work to do on our buses at transportation, so they're doing that. And then we are starting, I think starting Monday, we are actually doing like the Fresh Express, like we did in the spring, where we'll be going out to some high needs areas with our buses. So we'll have several buses on the road doing that once again. So we'll have drivers doing that. But once in-person starts, we'll be back on our routes. We're ready to go.
So as long as everything goes great, right, and the metrics and everything are trending the way that they are, that should begin right after Labor Day.
Okay.
All right?
And then, so Ms. Chancellor mentioned the communications plan, and kids might have to be moved so that the classroom can be cleaned, and then maybe they're brought back later. But at what time do we actually close a classroom or close a school? You must have Ron's mic.
It was Ron's effect on it, yeah. All of that is really going to be determined on the situation and what our health services recommendation is from there. It's been described to us, and we had a really interesting meeting with Emma Kelly this week. And, when you think about contact tracing, you may think it's just as simple. I did. Well, how far apart were you? Were you next to so-and-so? Did you have your mask off? Were you within 6 feet? How long were you guys together? But it's so much deeper than that. She showed us a flow chart that is quite complicated that they go on. But it's even things like, when you did have your mask off, were you loud? Were you yelling? How open was your mouth? Were you singing? It's very specific to that. But I think at the end of the day, it's about the contact tracing. It's about isolating the affected individual as soon as possible, using our safety protocols, and seeing if we are able to contain that spread. So if there is, for example, one student in one classroom and that spread is contained, there wouldn't necessarily be a reason to do that. I think how it's been described to me is, is it far-reaching across that campus? Is it isolated to a classroom? Is it isolated to a grade level? Are there many cases all throughout the school with very different people who haven't had any interaction? Perhaps that would warrant a situation where they would recommend a school closure for that time to make sure that the entire campus is sanitized. But I wish I could give you a clear cut, if this, then that. But I think that it's really going to depend on the situation, and every scenario is different.
Okay. And then last, Dan, I didn't want to leave you out, so I know you mentioned face shields, and I know sometimes folks think that, if I have a face shield, then I don't need a mask. But I did hear you say that folks can wear face shields, however, they still need a mask.
Yes, ma'am.
Is that right? You got Ron's mic again.
Yes, ma'am. Yeah. Roger over here turned off my mic. But yes, ma'am. No, I mean, there's been some questions, I guess, before, a couple of months back when people were saying, well, you just use a face shield, I don't have to use a mask. But, you know, all the studies point to, and it's a requirement that if you're gonna wear a face shield, which is, you know, some more protection, you still have to use your cloth face covering.
Well, thank you so much. I'd like to also echo words of my colleagues here. I mean, you guys have done an awesome job in getting this plan together. I mean, not just this plan, but the guidelines, the 21-page guidelines, you know. and I mentioned to you, I read every page of that because it's so detailed. It talks about the parent's responsibility. It talks about the teacher responsibility in the different grade levels, elementary and secondary. And it addresses almost every little scenario that you can ever try to think of. I know there's more out there, but it goes into a lot of detail. So just thank you all so much for all of this hard work. And it's not over. I know this is just the start. And I know that the key is not what happens in the schools, but what they do outside of the schools that we can't control. You know, so we would have to depend on the parents, on the students, you know, on the high school students who tend to want to do what they want to do. You know, most of us have, you know, already been there. But, you know, the key is that outside behavior. And just to say, you know, this is not a political issue. This is a people and a family issue. So, you know, I know a lot of folks want to think that there's other things behind this. Just look at the numbers. You know, this is real. So thank you, thank you, thank you.
Mr. Byer?
I will piggyback on that and say thank you up front for everything, all the work that everybody's done. I tried to keep my questions organized. It didn't happen, so I will try to go by person and see if I can jump around here a little bit. But I wanted to start with the phase-in plan. Dr. Newman, just so I'm clear on exactly, I think I understand phase 1, but when I get into phase 2 and 3, when we're starting to split the teachers between those that are teaching virtually, those that are teaching in person, will those that are teaching virtually at that point still have kids in their classrooms?
No, sir.
Okay.
Once you are able to conduct the in-person, then the folks who are, the teachers who have been identified to teach virtually will be only doing virtual at that
Gotcha.
time. So this switch to the virtual and in-person won't occur until the teacher can be doing one or the other.
Can do that, okay. And then with like the phase 1, where we are going to have 5 kids in each classroom, what kind of support are we maybe giving those teachers, because they are going to have 5 kids, let's say, in their classroom, and if it's 5 8-year-olds, those 8-year-olds are going to ask, raise their hand, I need help. Do we have a plan to help deal with that situation?
Again, every campus is different, and every campus has a different amount of staff. So we anticipate working with principals so that they can utilize their instructional assistants, their instructional coaches, they have counselors, they have librarian. And so we'll be working with the principal to develop a plan. Now, if we have a student who might be disruptive, that student can
Sure.
be removed from the classroom.
Right.
And we do need to be cognizant of the fact that we will have special education students in there as well.
Correct.
And so we will utilize co-teachers and special ed instructional assistants.
Okay.
And Mr. Byer, again, you know, Dr. Newman has said it several times tonight. This is why we take a slow approach to it, because once you put a bunch in, how do you monitor and adjust quickly? So yes, we're incrementally scaling up, right? We can adjust and say, oh gosh, we need that. And maybe it's looking outside. Maybe the campus doesn't have enough, and so we go out and tap other people.
Find it.
Because remember, the resolution you all approved Monday night gives me the authority to adjust some folks around,
Sure.
right? As we need it as a district. So we're ready to deploy what we need
Yeah.
based on the need of that campus or that particular classroom.
And I think that spoke to the question earlier about the face coverings, like we'll find out how that, with 5 kids, we're gonna understand how that works and then adjust as we need to. So-
Right, but you train 5, and then you got those are good, right?
Right.
And then you put in another 5, now you're
And you
only
gotta-
dealing with 5 again.
Sure.
So then you can slowly ramp that up. Instead of trying to wrangle 10 of them or 15 of them at once, and they're, they may or may not
Yeah.
wear.
And when the kids come back, especially in middle school and high school, are they moving around throughout these phases?
No, sir. In phase 1 and phase 2, they will stay in the same classroom with their headphones, earbuds in, attending to their schedule. And then most likely in phase 3, the principal will determine the numbers that they can accommodate and make a determination if during phase 3 they can begin to move about the campus.
Mr. Byer, that is a fabulous question.
Hey, look at that.
It really is a good one, and we have not touched upon it.
Yeah.
Why are we limiting their movement? It all comes back to what Emma Kelly explained to us and this ability of contact tracing. The more movement throughout our facility, the more difficult their job becomes in trying to trace where this child has been. Remember, this plan is all designed around it. It's easy to open. It's more difficult to keep them open, right? By limiting that, because remember, at these phases, COVID in the community is not as low as a phase 3. So schools are microcosms of the communities that they serve. So if there's COVID in the community, you have to assume it's going to at some point enter the campus, right? Because they're just a community. And so we're limiting it to no movement there so that we don't close the facility.
Right.
We would just simply maybe close a classroom. We don't want to disrupt people's lives more than we have to. And so that's why it's designed exactly that way, is to incrementally do it. And then by the time you hit phase 3, numbers are down enough. And the question you may ask is, why didn't we put definitive numbers? Because numbers keep changing.
Right.
We get told one thing, and then 3 weeks later, something else changes. There is no consensus on these numbers, even among medical experts. Ms. Kelly and I talked about this whenever that was, Emma. They're all running together now.
Thank you. And then on the TEA waiver, you mentioned what we would have the ability to do is ask for an additional 4 weeks. Is that, we ask for 4 weeks, and then at the end of that 4 weeks, you might ask for, or is it just a one-time 4-week waiver?
We reviewed the TEA guidelines, and we will need to notify TEA. The only time that the board has been mentioned was that
The first time.
extension.
Okay. Okay.
Now, Mr. Byer, you're asking really good questions. So, as a board, you have the authority, under what we know as of today, for that 4-week extension. Now, you've heard Governor Abbott speak about the ability to go beyond that, right?
Right.
But nowhere on the TEA website does it show any waiver. All it says is if that becomes the problem, that health of your community is poor enough that you probably should not continue, that then we email waivers at TEA or whatever, kind of explain our case, and then they handle it on a case-by-case basis.
Gotcha.
So, it is our hope and our true desire that the community takes this seriously and that we work together as we discuss through this plan. I think people think of Northeast as it's just impacting us. But how we deal with this impacts the community. We just don't eat within the boundaries of Northeast Independent
Right.
School District. We don't do business just within the boundaries of the Northeast Independent School District. So all of that movement comes into play. So we're trying to be good stewards of in our community, and we need people to help us through this process, because if the Labor Day holiday hits and people just say, you know what, it doesn't matter, and I think you have to look at, and I mean, when we go home, we don't wear our masks, correct? When we're around our family. And what they're seeing, and Miss Kelly, correct me if I'm wrong, is that's where it's happening. It's once you let your guard down around your family, that's where you get COVID. Because somebody else has been out bike riding through a neighborhood. I won't say who that is. But he's out bike riding around the neighborhood, right? And I come home and we're having dinner. And that could be where it happens. That's why that self-screening at every day is so important.
You just segued into my next couple of questions, and I think, Mr. Jimenez, you were talking about the Metro Health, or the health service metrics. We've got the
Yes, sir.
six that we're looking at. I guess, are we, I know we reach beyond our NEISD zip codes, but are we using those zip codes to look at specifically within our boundaries where we might have areas of
I think,
flare-ups?
Mr. Byer, I think any pieces of data that would help us, and if looking at zip codes helps us, we're going to look at it. Any information out there that can help us make the best decision for the safety of our kids, we're going to utilize. And so if that information is there, and
Sure.
I know it is there, we will use it if need be to help us make the best decision possible.
And I know you can only take what you're given, so,
Sure.
and it's only as good as whatever they put into it. But as long as we're taking as broad of a look as we can.
Yes, sir.
And then related to that, with the kind of the green, yellow, and red sliding bars, that kind of thing, do we have, because we have our 3 district metrics, do we have something that we're sort of doing the same thing, where we're saying we're either good, fair, or bad, with just the 3 metrics we're looking at?
We've talked about that. We do have that data. We don't have it in a particular bar with red, yellow, and green right now, but that's something that we've talked about, of how we're going to ensure that information is shared with our executive staff, with our superintendent, to ensure that we're making best decisions. So that is something that we are working on.
Okay, and then where I'm kind of ultimately going with that is sort of a communications thing as well. Is there a way to show, even on our website, say, hey, today we are red, today we are yellow?
Yeah, Mr. Byer, I don't.
Taking all those metrics that we're looking at.
Here's the thing, is you already see that there's a bar out there for schools, there's a bar out there for the community. If we add more bars, right?
And I'm talking just sort of an overall, so that people
Sure.
can get a snapshot, and it's not showing 3 or 4 different sliding scales.
Okay.
Of
So to just be able to
But
say,
just say,
look,
if I
in
go
the
to the
school
front-
district right now, we're in phase
Yeah,
2.
the homepage of the website, just say, we're in phase 2, and here's what that means.
Yeah, I think that's
Just-
pretty
Just so that
doable.
people don't have to go
Ms. Chancellor,
digging for
or
anything.
Dr. Newman?
The only issue is, I think we're going to have different schools,
Well, that's-
maybe in different areas.
Yeah.
As I was asking the question, I sort of thought about that as well. So anyway, just some way to be transparent to get the word out. I know
Mhm.
our teachers and our principals and our staff are making phone calls, sending emails, and as a parent, that can get overwhelming to some people, that, you're getting 4 different, a phone call, an email, and a text all at the same time. And so if there's a way that we're, as best we can, wrangle that and consolidate that so that people can get sort of a quick snapshot and say, okay, Tuesday, we're all good, we're green, we're going to school, that kind of thing. Anyway, just a thought. There's not an answer to that right now, but just a thought. And then I guess related to the face covering specifically, as we're kind of going into that, are face coverings required at all phases, or by the time we get to the phase 4 and phase 5, we're letting people go in without face coverings? Do we have a plan for that?
Yeah, I think phase 4, I think once we get to phase 4, I don't think we'll be needing face covering.
Okay. And I'd also like to see if we can get a little clarity on when people are wearing them. I know there's, I want to make sure that's clear, is that the example we got was saying that if you're under 10, you don't have to wear it in the classroom as long as you can stay 6 feet apart, but if you're in the hallways, you know, that's fine. But what about middle school, high school? Like, what's the expectation, I guess?
Yes, sir. Yeah, I mean, they're gonna have to be wearing it in between going to maybe the cafeteria, since they'll be staying in their classrooms, I guess, and their social distancing, they might not have to, but it's gonna be recommended or required that they wear it. I mean, even if you're 6 feet apart, sometimes, you know, depending on who's saying what, you know, since there's a lot of going to be some maybe potential talking, or there's some in class, you need to be wearing your face mask.
Sure.
Your face covering.
So the expectation is that we're not necessarily
Yes,
going
sir.
to leave it up
And-
to each principal to
No,
decide.
yeah, no, sir,
what
no,
they do.
sir, no, and, you know, I guess a lot of it's gonna be, education, I guess, wise, as far as.
Sure.
You know, in the morning, reminding the students about the requirements and the expectations. I think as we do it every morning, I think it starts getting ingrained into their daily routine.
Sure. Mr. Jarrett, I had a couple questions for you. The survey that the data you showed at the beginning of the presentation, is that all the information that just recently came in as of, yesterday?
Yes, sir.
Sort of the deadline where people were having to make sort of a
Yes, sir.
commitment.
That's the most recent
Okay.
data that we have at
Okay.
this point.
And then as far as the technology goes, how are we on the distribution of the Chromebooks, the hotspots?
So at this point, campuses are still distributing technology. Hotspots have all been issued. Talked with Tom Johnson today. He's verifying that we still have enough devices to make the difference for those folks that have not responded to the survey. And so we used the math on this to kind of make a prediction on how many more devices we would need. And so
Got it.
he's verifying that we have those in the district so that when those people come in at a later time, we will still be able to distribute the technology to them as well.
Good deal. So as far as we know, the people that have asked for it have gotten it so far?
Yes, sir.
Yeah, awesome. And then, Mr. Clary, I had a couple questions for you, and then I think I'm done. The occupancy that you showed at the beginning of the presentation, is that looking at the instructional space or the campus as a whole?
Campus as a whole.
Okay.
If you look at, that's why you'll see some large numbers in.
Right.
But that's campus as a whole.
Okay. And so, I guess thinking through that, we'd have to make sure that when we do have kids coming in, for some reason we have a situation where we've got more kids than we can necessarily put in by occupancy, which I don't think we're going to hit anywhere, it doesn't look like, but we would be able to accommodate space for all those people.
Yes, sir.
For the transportation, when we do, I guess we're phasing it in, so it shouldn't be an issue, but if for some reason we end up getting a bus that has more kids than we can get on the bus, do we have a plan for that, a contingency plan?
Yeah, just like we do every year, you know, when we have buses that are potentially overcrowded. You know, after the first week or so, we start looking at where we can consolidate or collapse a route,
Right.
and then be able to take that, if possible, and move it to an area to where to relieve some areas, so some buses that have more students.
More students, okay. That's all the questions I have.
Mr. Byer,
Yeah.
it's, I mean, we've talked at length about this. Mr. Clary and his transportation team have worked, you know, you cannot predict. We don't know where necessarily the kids will be. So it could be that, you know, the first day or two that there's a few more kids on a bus that we don't have the spacing that we have. And that's what he's talked about with them is this piece of being able to go out and then pull another driver, and we may have
Yeah.
to adjust the route and do. Again, that's why we got to start small and scale up.
Sure.
You know, I've talked to many of my colleagues that are trying to get people to reserve a bus. You know, look, we're pleased with the over 60% response rate, but still that's a lot, right? So,
Right.
okay, so how do you then get, and again, some of the problem that we have is people took the survey earlier this year, right, and thought, well, that still counts. No, that was just
Right.
for us to gauge. And so
Yeah.
at some point, there's a balance here on asking too much because
Right.
it lends to confusion rather than, we're going to have to try some of this. But, something that he hasn't talked about, and Mr. Clary, jump in if I'm off, but, we've heard things like putting up plexiglass in buses and say, y'all, we can't do that.
Yeah.
We can't. That is against.
The TxDOT, or not TxDOT, I've just drawn the blank. It's the U.S. transportation rules.
Not the heating and air conditioning. people.
No, not ASHRAE.
Not ASHRAE.
That's the
Texas.
American Society of, anyway, on the buses, that you can't modify the interior of a bus.
Gotcha.
I mean, they are what they are. Now, you may see some guidelines or some, on new buses in the future, you may see some design, but as far as going in and retrofitting and redesigning the driver's compartment is not something that you're allowed to do.
Right.
I've said the last few weeks, on the transportation, the reason we won't know for a few weeks is because it would be really nice for us if every kid that was going to ride the bus and come to school lived all on the same street. But we know that's not going to be the case.
Yep.
And so we'll have to adjust and, as we go.
Yeah. I mean, it's hard enough on a normal year.
Right.
This year, it's even more. Anyway, thank you, everybody, for what you all have done. Thank you to the teachers that aren't here, the principals, staff that aren't here, that have helped you guys put this together for us. It's great, and I also appreciate Dr. Micah letting us know up front that you don't know, because there's a lot of people who say they do know, and I think it's great to be able to say we're doing what we think is best. And whatever, to the millions of people watching, whatever decision you make, I mean, you're not wrong. You're making the right decision for you. And so is your neighbor. So I'll leave it at that.
All right, I'm stuck in the corner, like here. No one can see me. I have a question about the waiver, so Dr. Newman. So if we are asking for that extension, correct? So that puts us at there's a date for that, I guess, because we are doing the first 4 weeks of virtual instruction that would put us back into like Labor Day is the day. So if we ask for that, it's beyond that day, correct?
I believe the fourth week is the week after Labor Day.
Okay.
Mhm. And so if we ask for the additional 4 weeks, if I think I understand.
Yeah.
That'll take us into phase 3.
Okay.
And most likely, well, we're hoping to be able to begin the virtual versus the in-person, and will not need an extension because we're accommodating all those who have requested to come in person.
Okay.
But we don't know that for sure. We don't know if we're going to have to take phase 1 and maybe extend it.
Sure. Okay.
So it is fluid, but in looking at capacity and versus those who want the in-person, we think most likely phase 3. But again, there could be a couple of exceptions.
Okay.
Yeah, so Mr. Leos, the way, if everything works perfectly, all right, the health indicators continue to decline, people don't change their minds after 4 weeks, because remember, they have that ability to choose in person or virtual each 4 weeks, right? If everything stays static and we stay on track, we will phase everybody into in-person learning within that 8-week period. That's without any disruption, all right? So that is what we designed it around, to not come back to you all if that's how we have to do it. I guess someday I'll learn if that's how it happens or not. But that's what we're trying to do is stick within that 8-week period and get the folks back in. And again, based on everything we know as of right now, that would happen by like week 7, I believe, isn't it, Mr. Jimenez, that we counted? We'd still have a week in
We
there,
still have one
right?
more week to play with,
We
yes,
would
sir.
still have a week of that 8 weeks to play with.
Sure.
To get it in.
Okay. All right. That was that question for TA. And I guess this other question is just like a logistic question, and maybe I overlooked it here if it was presented. But is there, I guess, when we start using, utilizing transportation and parents are picking up their kids when we start phasing in, is there going to be like, staggered times? I'm thinking of elementary level specifically, but I guess it can go for any level, where, this section of the classroom is, or of the school building is, okay, now you're going out to be, picked up, and then we're doing that, and then after that, the next section of the building is being picked up. I just didn't know if that has been discussed or talked about, or for, instead of all of mass.
Not for official drop-off. Now, within the campus, the
Yeah.
principals have been preparing for arrival and dismissal and how to do that with
Okay.
distancing and safety guidelines in place.
Okay.
But for official transportation and school start times at the elementaries, no, sir.
Yeah, I meant what you just said, the second part.
Okay.
That's what I really was,
Okay.
I didn't mean, for like officially, but for each campus-based and principals making the decisions, I just didn't know that was
Right, the
talked about. Yeah.
principals have been given a lot of considerations, and they came up with a lot of considerations that
Sure.
we included. And so arrival, dismissal, lunchtime, there are a lot of
yeah.
things that these principals are going to have to work with their teams at the campus to figure out the logistics of.
Normally at dismissal for a bus, we usually have about a 10-minute window. And we simply have that because we've got to get these kids home and move on to the next level, grade level, move on to middle school or high school. So there is a window in there. There used to be a day when you could kind of fudge and, let certain classes out early, but those days have gone now with the minutes that have to be accounted for. But there is about a 10-minute window, and hopefully it won't be too bad because it'll depend on how many kids we have on campus, at that time. But I think we can do it in an orderly and in a safe manner.
Thank you.
Well, I was just going to add
I'm sorry,
to.
I can't see you.
It's okay. I was just going to add during the day for secondary, there's additional time built into the passing period so that campuses have some agility to release classrooms in a very strategic manner. We also built in additional time during the lunch periods for Ron's team to come in and clean the cafeteria before the next group arrives, and so that additional time has been built into the school day for the kiddos and teachers.
Thank you. Thank you very much, guys, for all your extremely hard work. I'm continuously impressed that you guys are on point with everything that you have done, and I just can't. I can believe it because I've seen it. How quickly you have you respond and you give us answers and all that goes a lot. That's a lot of research. There's a lot of time on your part, and I'm impressed, Dr. Micah, with your staff and how quickly you respond to us, and I'm really, really thankful for all your hard work. So thank you very much.
Forgotten one from earlier from a couple of parents that they were thrilled to see the AB schedule back. And of course, we all know why, as much as it's a dearly beloved schedule, we all loved it, and from a financial standpoint, it had to go away. But is there talk of keeping it after we're all phased in?
Yeah.
Just curious.
Miss Hugh, I think I would answer it like this. I'll go back to graduations again, right? What we heard pretty much universally across the school district is you should never go back to Freeman. That was really neat.
Yeah.
There are a lot of principals, counselors, teachers that have said, I think we're really going to like this, and I'm not sure we're going to go back. Again, as I've said in some of my messages, You know, I think we've, at this time of a pandemic, we've spent so much energy focusing on the negative that we've forgotten to focus that there may be some really good things that are going to happen. And we may now find ourselves in a world next year, you know, post-pandemic, where students never miss a day of school. Because we've now figured out how to break down this digital divide and let that child connect. You know, think of, there's been a death in the family and that child has to travel, but they can remotely connect back into their classroom and never miss. We have students that are in UIL and band and dance and that are traveling all over, right? Over to Austria, over to Florida. And now instead of having 4 and 5 days of makeup work, well, they just log in every day and do some work. See, those are the great things that may happen through this. So to that point, could the schedule remain? Maybe. I don't know any of us that can predict what's going to happen, but we are trying to keep as an open of a mind that we can through this, and then continue to listen to our employees, to our community, and to our students about what works for them, not what works simply for us.
I was going to, if I just can real quick, I'm sorry, I don't mean to interject, but just along those lines, like this afternoon, I did my Meet the Teacher on Zoom. And what I liked about it is that I didn't have to leave my office. Now that's something, and you know, thankfully too, we moved offices, so I'm a lot closer. We office inside the district's footprint, that's great. But I mean, I didn't even have to leave my office for that. That was really kind of nice. It took about 15 minutes. And you know, it was just kind of exciting because it was something new. But to go off what you just said, there are some, you know, unfortunately it's taken this, but I think it's pulled it forward, or we've, you know, been able to advance some of these things that might have been inevitable, but there are some you know, benefits to having gone through this.
I mean, think once this pandemic is over and we get all the traffic back that we're all, you know, that we all know is real. You know, so many times as a principal, I saw parents hurry in to meet the teacher, and they're so frazzled that they don't enjoy the experience. Well, now all of a sudden you have the ability to connect and never leave and not worry about, oh my gosh, I'm going to be late, right? Those are the opportunities that we're beginning to see. And again, I think, and I really hope, that people have seen that a system that they have for so long, for decades, said it will never change. How nimble it really became.
Yes.
And how nimble it really is, and how open-minded people are. And again, I hope they don't cast a broad brush against anything, because there are people on either sides of this, but there are lots of people in the middle too. And they're just doing, to your point, Mr. Byer, everybody is making decisions and they're all correct because it's based on their circumstance.
Dr. Micah, just real quick.
I didn't know either.
It's that voice from above.
Since we were talking about virtual, we do have a family that's, I guess, quarantined in Korea that we've been working with, or Tom's folks have been working with, for them to be able to VPN in to their class. So I guess we are international now.
Which brings
That's
up the
cool.
question, what is our enrollment? I saw in the survey that there were less than 300 that said they would not be returning to Northeast for whatever reason. I know people had to move out of the district because of family issues with COVID. How are we looking for enrollment?
We just, right now, we just looked at projected enrollment and it was at 60,000. So first day count on Monday, we will be able to tell how
Okay.
on point we are.
But remember, you know, TEA has given us a hold harmless 12-week period. Because to your point, Mr. Byer, right, you know, and again, if you think back, and I often ask people to go backwards in time to remember where we were so that we can appreciate where we are, is back in the spring when COVID hit, remember there were a lot of districts that really struggled with, we'd only contacted 75%, right? We were so fortunate that the amazing teachers, counselors, you know, principals, administrators, all these folks were out there connecting with 94 to 98% of our people, kids, right? very quickly. But see, in this point, we know day one, who knows, right? It's gonna take. Now they're out there making phone calls. You know, we're trying to find all of those folks. But you know, we talk about this every year. The first day of school, all of a sudden you have thousands of people enroll.
Right.
You do. And so it will be interesting to see, but so far it's very promising, the look. But we will see, because as if you'll recall, when you guys approved the changes to FDA local, why part of what we said is we simply do not know the demographic shifts that have happened with people that have lost their jobs and had to have moved because of it. So, you know, next week we will really start to see what that's going to look like.
Did anybody else have any other questions?
I did have one more I forgot to ask. So Dr. Micah, and I don't know, maybe Dr. Newman, this is something you would answer. You know, we're talking about the phases and going forward, and of course they're all based on how we as a community and we as a district behave outside of the school, and where we have all of these rules and regulations for the safety of our kiddos. But what happens if we have to go backward? Do we go from phase 3 to phase 2 to phase 1? How does that look like? What does that look like?
That's an excellent question, Ms. Winkley. And we'll let that, I think.
He's ready.
And I'm not quite sure how we would do that. I think we proceed carefully from phase 1 to phase 2. And I don't think we would progress if things are looking like they're trending downward in the community, in the city. That's why we have to go very, very carefully. So that has not come up yet at this time.
But Ms. Winkley, anything is possible. And so, you know, again, we're going to be identifying children at each stage, right? So if we had to go backwards, if we're at phase 2 where 10 are in a classroom and we have to go back to phase 1, then those 5 extra kids go back to virtual learning. And we stay at 5, right?
Okay.
Again, this process that we're going to go through is really about you know, it's like the tortoise and the hare, right?
Slow and steady.
It's slow and steady.
Slow and steady wins the race.
You know, I'm sure many people have seen, and again, I want to reiterate, I encourage all of us, don't judge any district what they're doing. We're all trying our best right now to do what we think is right based on our communities. But you know, you may have seen on the news the school district in Georgia that opened and quickly closed. My wife's very good friend that she grew up with, 2 children go there. And so we have a very unique insight into that experience. And I encourage people, don't paint a broad brush and say that's what's going to happen. Because there were a lot of factors that went into that. You know, masks weren't required. Social distancing wasn't even attempted. So, you know, again, we tend to look around at this and say, well, that's what's going to happen. Yeah, I don't know. I don't know that any of us can predict that, right? So, but what we're doing is that slow and steady tortoise and the hare. We're just going to go small because, to that old adage, right, go big or go home, we may go home. And that's not going to help any of us. That's not going to help our community, our parents that need our schools to open, our kids that need it. We need to do it and keep them open. That's the charge that my staff and I have taken on.
Did you have something you wanted to say? I feel like I need to. Go ahead.
No, only thing that I would add is, to Dr. Micah's point, everything is not done in a vacuum. And so in preparation for the opening of schools, we also prepare for micro-closures because those can happen at individual campuses and not necessarily the whole district. And so a campus may close, but other campuses may stay open. And so those kiddos may go back to a virtual space with a soft opening at that site, but the other schools may be functioning at a different level. And so we just have to be prepared to adjust and modify accordingly based on the campus and that community need.
And I'd also like to add that through this whole process, there have been barriers that have been brought up, and we have found a way around these barriers. So should we have to go back, there may be other options that we can explore. But I think this team with Dr. Mike has done an excellent job of taking these barriers and figuring out strategies that are the most win-win for everybody concerned. And so it's really hard to anticipate some of those barriers, but I have no doubt that through the collaborative efforts, we will be able to find a solution.
Yeah, y'all have just done an amazing job, and sleepless nights, I'm sure. I did have a question, and it's like from the very beginning of the present, or was everybody else finished? Because I was just gonna end it and then motion.
Did you ask Max Headroom over there on the TV screen?
Yes,
She
I'm
had her
done.
last question. I just gave her, right? Or do you have something else?
No, I'm done. I'm done.
My concern is at the very beginning, you talked about the number that had responded to the surveys, and so it looks like it's about half. Can we go back to that number? 61%. Okay, but so I guess my concern is that there's still parents that we haven't reached, right? And so what's going to happen Monday? Are those? Are they going to know that they need to be virtual? Are they going to know that they need to have a device? I mean, I guess I'm just concerned that it seems like, I know our percentages are great, but what about those people that we haven't heard from?
So the survey is sent out. That's just one mechanism. And so our
Okay.
campuses have been also calling
Okay.
these families. Some have done mail outs, so they have hard copies inviting them to the school. And so those folks are not necessarily captured in the data because
Okay.
they didn't fill that out. So there's been extended effort at the campus level
Okay.
to help find many of those children and get them connected.
Okay,
And Ms. Grona, I'm so glad you brought that up, because this is my PSA to our community. If you have opted out of messaging through our system, please go and opt in, because that is so important. That's the notifications Ms. Chancellor spoke about. That's how they're coming. They're going to come through email, through a phone call. So you have to go in. If you are unaware how to do that, then reach out to the school district. We can help you with that. Ms. Chancellor, you've got what, news@neisd.net?
Yes, and I just did want to add to that unfortunately our system is built that some of our parents didn't realize that at some point they did opt out. If you opt out of one text, if you opt out of one email, the system is going to count you as an opt-out. And so even when you go in your screen, you are not able to see that you have indeed opted out. So you do have to contact us, news@neisd.net. That is what we have been doing, oh my goodness, so much of this week and last week. So we're thankful for those people reaching out because they had no idea that they had actually opted out, and we're able to uncheck that box for you, and then you're able to receive those notifications. So one more time, news@neisd.net. Let us know if you're having some issues.
okay, thank you. Great, thorough presentation. I mean, thank y'all for all of your hard work. It's just really, and gosh, 1 of 5 in the state. I mean, again, kudos to y'all, congratulations. I mean, once again, we're just leading the way, and it's just, it's so impressive and so nice, and it just is great to be associated with this wonderful district. So at that, oh, okay, I thought you were trying to get my attention. And my contact is all messed up, so I'm having a hard time. Do I have a motion to approve the district reopening plan as presented to include submission of a request to the Texas Education Agency to extend the start of the 2020-2021 school year transition beyond the initial 4-week limit?
So moved.
Thank you, Mrs. Huey. Do I have a second?
I'll second.
Thank you, Mr. Hasso. All those in favor say aye.
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 Opposed? The motion carries. Thank you again, everyone. Item B, consent, 50,000 purchases. Do I have a board member wishing to pull an item from consent? Seeing none, do I have a motion to approve consent as presented?
So moved.
Thank you, Mr. Leos. Do I have a second?
Second.
Thank you,
Second?
Mrs. Williams. All those in favor say aye.
Aye.
Opposed? The motion carries. Item 6, adjournment, and the time is 8:10. Thank you all again.
Thank you.
I'm so proud of this plan that y'all have put together. Yeah.